The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Hello, everyone. My name is Dr. Charlene Ortiz, and today we're going to be talking about the differences between gender, gender expression, gender identity, sexual orientation, and other things that tend to be really confusing, even for practitioners such as yourselves. So one of the things that we have on the agenda today is talking about one of the presentations that worked really well for me when I was an intern back in 2018. One of the things that was presented to me back then was the image of the genderbread man. However, in this specific case, we're usually used to just like the cookie version of it, but this is a really good illustration to see the differences between what exactly is gender expression, what is gender identity. So let's talk a little bit about what do you guys think gender is in a very generic sense? What does gender mean to you?
What you were born with.
Biological?
Biological. To
Okay,
me, that's gender.
so how is that different from sex? Right, so there is a difference. So generally, let's start with the illustration that we have here for our genderbread person, and then we're going to carry out with the specific definition.
Gender or sex is the biological, which you're
Yeah.
born with, and then gender is what you identify as
Yeah.
or what you present to what society as.
Yes.
So let's look into the illustration that you guys have presented. Of course, this is not my own authorship. This is an idea that others have presented in regards to the genderbread man. Here he's got like a little hump. Here we go. So one of the first things that we need to talk about is sex. Sex, as we understand it, is a biological concept, right? So generally when we're thinking about sex, think about genetic characteristics, think about biological characteristics. So for example, you're thinking about sex in regards to, let's say, XX chromosomes, you're thinking about XY. We do have some other presentations of sex chromosomes. So for example, we have X0, and we do have some genetic concerns that may arise with individuals who have those concerns. But generally, when we are referring to sex, we're referring to biological aspects. So for example, genetic codes, which would be X, as you know, for female and Y for male. So notice that the clear distinction is that sex is a biological concept. So having understood this, how would you guys define gender? Now that we have the explanation for XY or XX as a biological concept, as a sexual concept.
Social presentation or identity.
Okay, they are related. We are going to draw a distinction between what exactly is gender and then gender expression. When we're thinking about gender, sometimes you hear this controversy that, for example, there's only two genders. Well, in reality, there's as many genders as that society deals them to be, right? Because gender, the difference with gender is that gender is a social construct. So for example, think about sex as a biological concept. So if I were to draw your blood, for example, we would have, and look into your genetic material, it's biological. However, gender in that specific sense, when you're thinking about gender, now you're drawing the distinction within a social concept. So here you will have male and female, whereas in a social concept, now you're thinking about man and woman. And unfortunately, we use these terms interchangeably, which is why many of us get these terms confused. So whenever you're thinking about biological aspects, think more about male and think more about female. Whereas when you're thinking about gender, now looking at the biological concept, now you're looking at the social concept. So now you're looking into man and woman. Now, because it is a social concept, these concepts are going to change with time. They're going to change based on generation. So for example, think about the idea that you might have had in regards to what does it mean to be a man? What does it mean to be a woman? Now think about what your grandparents might have thought that meant. What did it mean to them to be a man? What did it mean to them to be a woman? So notice that not only does it cross aspects of society and that specific culture, culture being the conglomerate of beliefs and values and rules in which that society governs itself. Right? So that's the concept of culture in general. So what are our values, our beliefs, and the set of rules, social norms that we have that allows us to function in that culture? So not only does it change culture to culture, but it's also going to change within the same culture as time progresses. And the example that I like to use as well, the concept that I would have of being a man or a woman because, for example, I'm a millennial, so the concept we have compared to, for example, my grandparents who were boomers, right? And my parents who were Gen Xers, right? So the different generations, they also have a different concept of what it means to be a man and a woman. See, that's when people get confused and say, okay, well, there's only two sexes or only two genders, when in reality, there can be as many genders as that society deems it to be, or as many genders as is acceptable for that society. So then some of your clients are going to have these issues. So for example, now you're going to start seeing individuals who are using these terms interchangeably. So now, for example, you have, say, Billy, right? And Billy's parents, for example, will say, well, there's only two, and I don't understand why my son wants to identify as a female. Well, in reality, what's happening is that that concept of being a man or a woman is different for Billy. So maybe Billy does not want, therefore, to be referred as a male, for example, treated as a male, even though you may have those concepts genetically, that does not fit the social construct that he has for himself. So for example, instead of he, now he would like to use female pronouns, would like, for example, to use more stereotypically oriented aspects for females, so for example, makeup or not, because that is going to depend based on the individual. And remember, there is as many genders as the individual would like to see. So I wouldn't want you to think that just because you have a concept of this is what a stereotypical male looks like, this is what a stereotypical female looks like, and you have a client that says, well, I'm transgender, you're going to come across individuals who would say, I'm not transgender enough. And that is a really typical concept that I have come across, in which individuals would say, well, just because I haven't fit, if I am transgender and I'm going from male to female in regards to my transition, then they will have a presenting issue and say, well, I'm not transgender enough, because even individuals within the transgender community could expect them to be expressing themselves in a different way. So any questions about that specifically as to how an individual, for example, may have a presenting issue of saying, I simply don't feel like I'm transgender enough. So let's talk a little bit about gender expression. What would that be specifically? If we're thinking that gender in and by itself is a social construct, what would you tell me then is gender expression? What would that be?
Outward appearance.
Right. So what you're thinking about is behaviors, right? I like to think about behaviors as anything I could record with a camera, right? I like to think about behaviors as verbs. So crying, reading, punching a wall, right? Behaviors that I could physically record you doing, right? So I like to think about verbs as think actions, right? Behaviors. So an example of that is saying, well, I can't really see your depression. However, I can see you crying, laying on your couch, eating Doritos and a bucket of Ben & Jerry's, right? So then we can extrapolate the behavior and infer maybe this is a stereotypical symptom of depression, right? So remember that when we're thinking about gender expression, what we are referring to is what is the presentation of the individual. Notice that they're also going to be really closely related to the social construct. So for example, gender identity, or think about gender expression, think about they are closely related to gender because, for example, in our society, we would assume that individuals who wear more tight-fitting clothing, for example, or are using a purse, for instance, that these individuals are presenting themselves as more female. However, that concept is also going to change. And the problem with making those assumptions is that now we may unfortunately be invalidating the identity that that person has. So, for example, think about gender expression as the outward expression, right? Think about it as the outward presentation of that individual. So think about presentation. Think about gender as a social aspect, right? My little brain, that's my little brain. There you go. That's at least a 7 out of 10 brain. No? Anybody? No? I didn't work on it. There we go. That better? No? Okay. We have the biological for sex, the social for gender, and the presentation external for a little genderbread man. Any questions about that or differences between them? What is sexual orientation then?
Who you're attracted to?
Correct. And I like that she didn't say the person that I have sex with. Those are very different terms. People usually would say something like, well, sexual orientation is based on the person you have sexual intercourse with or sexual relationship with. And that is not true, right? Sexual orientation is the romantic, emotional, and sexual interest upon a partner. So notice that I didn't say sexual intercourse or sexual activity. I said romantic interest, sexual interest, emotional interest. Because, for example, you may be in a situation in which an individual will identify, say, for example, as heterosexual. Hetero meaning contrary, right? And hetero in this sense means being interested romantically, emotionally, or sexually on the opposite, on the contrary, on the opposite sex. But for example, the same individual that you just asked them about their sexual orientation, this individual may come to session later and say, well, I enjoy having sex with men. Or I have sex with men incidentally, for example. Notice that this individual, for example, if I am heterosexual, if I am straight, but then I have, for example, a sexual fantasy, for instance, of having a sexual relationship with a female or having a romantic relationship with a female, does that inherently make that individual gay or bisexual? Notice that what I was mentioning is that it depends on the classification that the individual wants to provide to themselves. And it's really easy for us as practitioners to immediately throw that label at the clients, in which case, not only would you be ruining rapport, think about the history that this individual has gone through before they saw you of invalidation, right? Of not being validated, say, for example, by society or their own families or their peers. Now, you may have an individual, for example, who identifies as heterosexual, but then says, I have sex with men incidentally. Every now and then I will have sex with men. And notice that that individual will still use the label of heterosexual. And that's not necessarily atypical. It's more common than what you think, particularly in more rural areas. So for example, you may have an individual from a rural community and they will identify as heterosexual. But then, for example, later on in looking into their history, they would say, well, I have had sex with men, or I still have sex with men, or I enjoy sex with men, or I want to have sex with men. But they would still classify themselves as heterosexual. You may find that in a prison population as well. And so in which they will still identify as heterosexual, but then they will report that they have a sexual intercourse with individuals of the same sex. So it's not as atypical. Romantic, emotional, or sexual interest that you may have upon a partner or a potential partner. Does that make sense? Because these terms are unfortunately used interchangeably. Yes, ma'am.
On the orientation, especially like you had mentioned, the prison population, is that really a romantic or emotional type of connection, or is it just because that is what it is?
Right.
And those relationships become very, very close. Now, yes, it's because the environment forces them together,
Right.
but Are you gonna say it's any less real? You know,
Yeah, but does it start because of convenience and then because of the attachment, then turn into relational and
keep in
emotional?
mind, what you're assuming is that other relationships just start spontaneously in a very natural way, quote unquote.
Okay,
And the problem is other relationships, basically start because people are put together and the environment is facilitated.
okay.
Right?
In prison, there's I guess a stigma you would say of a lot of men committing rape to like exert power and control.
So in that case, I wouldn't classify it as sexual orientation because the difference would be with sexual orientation is a consensual. So usually we would assume that they're equal partners. But for example, if we have an individual, say in prison, who decides to engage in a sexual act because it's going to offer them some sort of protection, was that really because of sexual orientation, or was it really because of coercion, or because of threats or safety or food, even something as simple as eating? So in that specific case, there isn't a form of consent in the sense that we expect an equal exchange of either sexual interest or romantic interest or emotional interest. In this case, there is a huge power differential. And in the best case scenario is coercion, and in the worst case scenario is sexual assault and is coerced. So I would classify them as different for sure. It will still be seen as a form of coercion for sure, because the individual doesn't have the capability to provide that equal consent, if you will. So what I want you guys to do is look at these terms that we have available. And I want you to select the term that you would like some clarification or a group discussion or anything that you say, I need some more information regarding or more clarity with this specific topic, with this specific concern.
Does the term queer, is that now have a negative connotation in our culture now?
It's actually the opposite.
It's
So,
opposite,
so
okay.
one of the things that has happened, it used to be considered a very derogatory term, particularly earlier, probably along my generation, it has started changing. So with millennials and centennials, but early, older millennials and older, it was considered a derogatory term. So now one of the things that, if you ask any sociologist, they would tell you that words don't actually have any power, right? That it's only the power that we assign to them. So a lot of the LGBT population, what has occurred is that that term has been adopted as it has been moved inward so that it has lost its power. So now it's actually considered a not a derogatory term. And you may actually hear it from your clients. You may actually utilize it yourself in session. You may, for example, whenever you're conducting your initials, we actually have that option within our initial to describe the individual as queer should they use that term, but it's not considered a derogatory term anymore. It's actually been moved around and shifted. That power has moved. It has shifted to an underserved population or underrepresented population.